Thanks for staying with us. If you've just joined us, thanks for coming along. It's time to shift gears to another groundbreaking initiative, really, in the healthcare sector: accessible and affordable HIV testing, treatments, and care with the Health Connect Jamaica mobile app. Developed by the University of the West Indies Faculty of Medical Sciences, this app is designed to significantly enhance healthcare delivery and accessibility throughout Jamaica, connecting patients with healthcare providers, offering vital information, and even supporting the management of medical appointments and updates. Director of Health Connect Jamaica, Dr. Alicia Webster, joins us to share how much this cutting-edge technology is now really potentially transforming lives and bridging gaps in healthcare access. Welcome, Doc. How are you?
Good morning. I'm good, thank you.
Where's this idea? We're good. Where did the idea? Well, clearly the gaps were there, and that's the way science works. You try to bridge gaps.
Right.
But you know, what was the thinking behind the design of this app?
Right, so, you know, we were looking at our health landscape and what the community was like. And we know now through research that half of the Jamaican population is under the age of 25 years of age. And so in order to reach the underserved, unattached youth, in general, we knew we needed an innovative healthcare solution, and what better way to reach the youth than through social media and apps.
It's funny that you say reach the youth. Are we taking healthcare as seriously as we ought to be when we look at the younger generation and how they approach their overall wellness and their health?
So it's a two-pronged approach, right? Because the youth, they feel invincible, but at the same time, we are in the information age where they have all this information accessible to them through Google and the World Wide Web. But at the same time, you know, what is common is common. So we find that people will research things on healthcare, but they won't actually go in to a doctor's office and get their regular health checks. They won't actually go in to see a specialist if they have a concern. The first thing that they'll do is go online and research their symptoms.
You know, according to WebMD, everything,
right.
You know you have cancer, you're gonna die in 2 business days.
I'm telling you,
everything.
I have friends that question me about WebMD, and I'm like, are you going to trust WebMD or are you going to trust my MD?
Right. Right.
I like it. You know, but a part of the challenge I think that we face is that some people, particularly men, have poor health-seeking behavior, and so, but they'll be in their phone.
Exactly.
I mean, how can the app, or is the app designed to improve health-seeking behavior by making it easier?
Yes, so the app is user-friendly and innovative in its approach, right? So not only are you able to access information about HIV prevention, treatment, testing, you're able to also order HIV self-testing kits. So for example, if you wanted to know your HIV status, you could order a kit through the app to be delivered to your location or to be collected at one of our partnering pharmacies, and then you are able to take your healthcare into your own hands. So we plan to enhance accessibility and empower persons to take their healthcare into their own hands by using the app.
One of the things we said in the intro as well was the ability to make appointments.
Yes.
That's probably really important because half of the battle a lot of the times is picking up the phone, calling the office, making the appointment versus just being able to take up people and say, all right, log that in.
Exactly.
Walk us through that.
Yeah, so through the app, persons are able to go in, make appointments to speak with one of our peer navigators or to see a clinician if they so desire. They're also able to access our peer navigators and our clinicians through audio, text, and video calls.
Oh, wow. That is very cool.
Yeah.
That's really important.
So we really took into account, you know, the different needs that people may have, and we're still testing our landscape and improving our digital landscape and getting feedback from not only the youth who we really target, but the wide spectrum of ages.
I mean, just yesterday, Apple announced, you know, a raft of changes with AI and how it's going to be engaging apps. We've already seen Meta start moving in that direction. Are we going to have in the long term of this app, you know, some AI integration into it.
Yes, we plan to do AI integration. So the app is built on blockchain, right?
Okay.
To ensure privacy and confidentiality. And we plan to integrate AI into it in order to also serve people living with disabilities, right? So to make sure that the app can generate audio from the text content and ensure that we're able to reach everyone.
Awesome. I have to ask because, you know, sometimes we have to ask the question and then really, sometimes you download an app and you're like, ugh, the user interface is horrible. Tell me about the user interface of the app. Is it nice? I want a nice. I like
it's
aesthetically
nice. The
pleasing
first
app.
thing, as you open the page, you'll see the beautiful royal blue and yellow of Health Connect Jamaica. You're greeted by a friendly face.
Okay,
and
good.
there are video instructions on how to use the app, what the app's about.
All right.
If you need further assistance, right there and then, you know, you just choose whether you want to you get a HIV self-test kit or you need treatment, and the app will actually guide you along the process with pop-ups.
Well, we know all about it. When can we access it? Where can we access it? Tell us that next.
Sure. So we are doing the final on-the-ground testing, but it should be available in the App Store for both iOS, you know, all of the iPhone users, and Android. Not me either. Samsung. Yes.
I use both.
I feel seen.
I use both
Yes.
equally, yes.
Yeah, I feel like I'm a creature of habit. So yeah, both iOS and Android.
Thank you.
At the end of the month.
Awesome.
Sounds good. Sounds good. Yeah,
And it's free to download, and it's also free to use. So once you've downloaded the app on Wi-Fi or in your homes, you can access the app anywhere without the need for data.
One other question.
Okay.
Wait a minute. Hold up now. That is actually very cool because you're saying to me it doesn't matter if I can buy a package, doesn't matter if I live where I don't receive service, I get access.
So for the initial setup, you either have to have a package or be on Wi-Fi to bring it down. But once you do, you will be able to access it anywhere, anytime within Jamaica.
Wow.
Very
Definitely.
cool.
Awesome.
Yeah.
Our guest has been Dr. Alicia Webster, the director of Health Connect Jamaica. Download it at the end of the month. It's now time for a break. Sunrise Earth is up next.
Yeah.